Good evening. Hope you've all had a good Monday. We have been pretty busy today. We've got a new team member called Josh who has been observing us, and some of you may have already met him, but it was kind of his first official day today. So he's been busy. Myself and Nat have also been super busy. So yeah, it's a good way to get the week started. I'll just wait a couple minutes for more people to join us and come on into our chat today about plantar fasciitis. And as soon as they have, we'll get going. A couple of you have joined now. Just give it another minute or so and then we will start. Hopefully you can all hear me okay. Great, so let's get cracking. Today we're talking about all things plantar fasciitis. So if you're joining this, it might be because you've got plantar fasciitis, you've had it, you feel like maybe you've got the start of it or something like that, and that's maybe why you're joining us today, or maybe you've got someone that you know who's got it and they're complaining about it, so wanting some help. So today we're going to go through, what is the function of the plantar fascia, what is plantar fasciitis, how do we diagnose it, and how do we manage it? So we'll be trying to cover all of those topics today. If you've got any questions, feel free to ask as we're going along. If not, you can always save them up and ask them at the end, but I am here for all of your plantar fasciitis queries, so may as well ask me. So what is the function of the plantar fascia? Well, it's got a few different functions, but the first one is that the plantar fascia is very important in maintaining the arches of your foot. So where your plantar fascia sits, imagine this is like the sole of my foot, this is my heel, it kind of sits along here, sort of fans out there. So it's incredibly important in providing that support that we need for the arch and for providing shock absorption. So if we're walking, if we're running, if we're jumping, doing anything on feet, really, we are going to be utilising that plantar fascia. So obviously if you've got pain there, you're going to feel it. The second function that we have of the plantar fascia is that plays a really important role in the biomechanics of our foot. So biomechanics is sort of the way in which our body moves and how it works. And it's got a really important role to play there in making sure, like I said, with the maintaining of the arch. So if that is compromised at all by damage, pain, injury, anything like that, then that can obviously cause you issues later on down the line. Despite the diagnosis kind of plantar fasciitis having that itis part of it, itis generally refers to inflammation. So if you hear of a condition like tendinitis, then typically we think in our head, or like cellulitis, for example, we think normally that implies there are inflammatory cells present there. But actually for plantar fasciitis, this condition doesn't really have any inflammatory cells present. So it's a bit weird that it's called plantar fasciitis. There are many different causes of heel pain. We've also got a fat pad there. You can get bony spurs, you can get other muscle injuries in that area too. So sometimes you might hear plantar fasciitis referred to kind of generally as plantar heel pain. And that's the reason for that is it's just kind of an overarching term that covers a few different things. So to also define sort of plantar fasciitis, I'm going to define the word fascia for you. So fascia is basically a thin layer of connective tissue that we have over all of our organs, over all of our muscles, every blood vessel, nerve fibre, every muscle, everything in our body, we have fascia that covers it. Typically we find with muscles that actually fascia covers like 3 muscles at a time, quite commonly, 3 or 4. It kind of almost like compartmentalizes different muscles. But what we also have is these really thick bands of fascia, like you might have heard of your IT band that runs down the side of your leg. that's a thick band of fascia, and plantar fascia is similar as well in that it's not this kind of thin layer that we get that covers all of the other structures in our body. It's a slightly thicker, firmer layer that sits in the bottom of our heel as well. So we've covered our, what does the plantar fascia do? Now let's talk about what is plantar fasciitis. So it is collagen degeneration in the fascia, because the fascia is made up of collagen, and it's the degeneration at the origin of the plantar fascia. So that is, imagine this is my heel, it's kind of around the heel area. But this can also impact other kind of local structures in the area as well. Frequently it is an overuse injury, and I know I feel like I speak a lot on our lives about overuse injuries, but increasing load too quickly, sort of over a period of time, can result in plantar fasciitis, and that repetitive strain can cause micro trauma to the plantar fascia, and in the end you end up with damage to the area. You get that sort of that collagen that it just isn't being laid down very well. You get pain in the area, and that's how the injury kind of comes on. As soon as we're starting to get collagen degeneration, what's happening is that collagen isn't regenerating, so it's not creating more of itself, which it would normally do anyway, but you're then damaging the collagen, and then when the collagen is then trying to regrow back, sometimes it lays down quite haphazardly. So we want it to be nice and strong, kind of along the lines of tension. If we're getting kind of mangled collagen sitting on top of each other, all that's going to do is create kind of scar tissue, create pain, dysfunction in that area, because it's going to be quite a strong band that's going to be pulling everything else near it. So that's what can happen with plantar fascia. And typically other things that can cause it, because this is the thing with plantar fasciitis, and not just plantar fasciitis, but almost every other injury in our body, if you've got that injury, it's been caused by something else. What is going on in your body that has then made this thing come up. So with plantar fascia, it can be loss of ankle dorsiflexion. So dorsiflexion, imagine this is my ankle and this is my shin. Dorsiflexion is the movement of bringing your foot up towards your shin. And that can be as a result of tightness in the muscles. So tightness in your calf muscles can cause a movement restriction at the ankle. It could be because you've had an ankle injury and then it's become stiff and you haven't regained that motion in your foot. It can be because you've had an operation, you've been in a boot. I saw a patient earlier who has been in a boot for quite some time, and he's like, my ankle just feels stiff and sore at the front. I'm like, of course it does, you've been stuck in a boot where your foot doesn't move for ages. So anything like that can cause a restriction at ankle dorsiflexion, and that can put more pressure on the plantar fascia as well. If you've got quite flat feet as well, so if your arches are a bit fallen, puts more pressure on the plantar fascia. It's having to kind of spread out over a larger area. That could then cause pain. And that's if it's like that when you're standing, but also if it's like that when you're moving and it's dynamic as well. Another thing that really predisposes you to plantar fasciitis is being overweight. The more overweight you are, our feet aren't that big and they're going to be carrying a lot of that load that you're putting on it. So any kind of excess weight that you've got that your body doesn't need isn't going to help in these cases. So if someone does come to the clinic and they are, their BMI is higher, it's often something that we'll discuss with them and say, do you feel like your weight might be contributing to this? Because from the research we know that actually in this condition that could well be the case. Having diabetes again is another contributing factor as well to plantar fasciitis. Lots of impact weight bearing activities. Sorry, thought I was going to sneeze. Sorry, excuse me. Other impact on weight bearing activities, as I was saying. So such as prolonged standing, lots of running, anything like that could cause plantar fasciitis. But if you've been building up your tolerance to a run, I know we've got a couple of runners that are on the call today. If you're building up your tolerance solely for running because you've got an event coming up, that isn't going to cause plantar fasciitis. But going, oh crap, I've got an event next week and I haven't bothered to train, I'm going to get 3 runs in this week, that's the kind of thing that's going to cause plantar fasciitis, because you're doing too much too quickly. And the same could be happening for running surfaces as well. So say you're used to running on grass and then you go and run on tarmac instead. Maybe the pitches are all waterlogged or something, and that's why you're running on the streets. All of that could potentially have an impact on your plantar fascia. Changing running shoes or having shoes that fit you really poorly. So if you've not got quite snug shoes for your sport, whatever that sport is, we want to have shoes that are going to be properly supporting our foot and our arch in the position that we want them to be in. So if we are walking around or running around without that, that can again lead to plantar fasciitis as well. Having a leg length discrepancy, so that's where if you're born naturally and you've got one leg that's quite a bit longer than the other leg, if the longer leg is going to have quite a lot of pressure put on it, so that can be a reason. But also tightness within the Achilles tendon and with the calf muscles as well. So I'd say for the people that I see in clinic, this is the biggest one, is people having really, really tight calves, and they might have been training in the gym, plus running, plus doing all these sports. And I'm like, okay, well, how often do you stretch your calves? How often do you get any kind of soft tissue on your calves? How often do you foam roll? Oh, I don't really do any of that. Okay, so maybe we're starting to see why this might have happened. And the thing is as well, just because you're doing all of these things with your calves, like you're running and walking and jumping and playing your sport, if you're not actually targeting them for a strengthening purpose as well, even though you need them strong, they're not actually going to be terribly well conditioned, and that could again lead to plantar fasciitis. And plantar fasciitis, I think, is a term that most people have heard of, and the reason for that is actually 10% of people will suffer at some point from plantar fasciitis, which is actually a huge amount. 1 in 10 people will suffer with that pain, and a third of cases will be bilaterally, which means both sides are affected. So it's not just that you can't walk on one, it's that you can't walk on both. On average, it lasts for more than 6 months, so it is quite a long-term injury. Unfortunately, it's not normally something that's fixed overnight, and the reason for that is, with this type of injury, as you can see, it's often a build-up effect. You've done kind of too much too soon. Maybe your foot arches, fall a little bit. Maybe you have super tightness in your calves. It's been going on for a long time. You've got all these things that build up, and eventually you feel the pain. And as soon as you feel the pain, you think, well, I need a diagnosis for this, or this is painful, I need to go to the physio, I need to get this looked at, I need to go to the doctor, whatever it is. But and then this, everyone's like, well, why has it lasted so long? It just came on overnight, and now it's still here, and it's 9 months later. Because it took you probably a year to get into this state, but you only realised you're in this state when you felt pain. And that's why it's so important to just be making sure that you're finding ways to maintain your body, whether that is stretching, foam rolling, doing deload weeks, coming to physio. We have loads of patients that come to us on like a maintenance basis, where they're coming once every 2 weeks, once every 3 or 4 weeks, for this reason, because we pick up on these things before you even realise they're going to be a problem. But it lasts that long because it's taken so long to get into that state a lot of the time. And 90% of the time it is treated conservatively, and conservatively means that you are treating it via physiotherapy rather than an operation or an injection or something like that. It is more common in females than men as well. My sort of best reckoning for that would be our biomechanics are different to men. Often we do have slightly more pronation seen at our feet. We have often got wider hips, so our glute minimi aren't always as well trained as they could be. That's not going to control our knee well, it's not going to control our foot well. So maybe that's why, but those same things could be seen in males as well. So moving on to our diagnosis side of it. So as a physio, these are the things that I'm looking at. So if someone comes to me and says, so when I wake up in the morning, my heels really hurt, I'm like, okay, this is probably plantar fasciitis. I'll do all my other tests, but I'm pretty sure that's what it is. Waking up in the morning with that soreness from where you've not been doing anything overnight, that is a really common symptom that people explain, that they're sort of feeling it right underneath their heel, and that can be quite sore and painful for them. Tenderness on the anterior medial side of the heel, so that means like the anterior bit on the inside of the heel. Often there's like a kind of pinpoint tenderness there, but sometimes it does radiate down, or it does go to other areas. It's not uncommon for it to spread a little bit as well. Having people that have limited dorsiflexions, like we mentioned before, that movement of bringing your foot up to your shin, you're more likely to suffer from plantar fasciitis. And we do actually have a test for that as well, called a knee to wall test, where we get someone to face the wall, and we try and get their knee to touch the wall, and we just see how far away can your foot go before the heel comes up and your knee's touching the wall, so we can say, okay, well actually on your right side it's X amount, on your left side it's Y amount. That's why we think you've got it on your right side, for example. Tightness in the Achilles tendon is another one as well that we'll often see. So if patients are presenting to us and their Achilles are quite tight, their calves are quite tight, along with all the other bits we mentioned, then that would be quite indicative to us of plantar fasciitis. Often people might have a limp and they might be doing what we call toe walking. So that's where like you might have one foot that's flat, the other one you're sort of on your toes as you're walking, because you're not wanting to put your heel down and have what we call like a heel strike and then push through the toe like that, because it's painful. So often people just come in like walking on the toe instead, and we're actually as physios kind of assessing you from the moment you walk in. You know, I'm looking at how you've walked in through the clinic, I'm looking at how you've gone up and down the stairs and those kind of things. If I can see anything obvious then I know that's already in my brain as part of my diagnosis for you. Often people with plantar fasciitis as well get pain going upstairs, rather than downstairs. So again, if someone says to me, I'm getting pain in the morning, I've got tightness in my Achilles, I'm having pain going up the stairs. Particularly, it's normally worse when people are barefoot or in poor footwear, like especially in the summer. We see a lot of people obviously walking around in flip-flops. They are not good for your feet. You are clawing at your toes to keep the top bit in. Not that I don't wear flip-flops, I do, but I don't really kind of walk around much in them. It's more if I'm just going from my house to someone else's. But you know, they're not great, so they're not particularly supportive shoes for those that have plantar fasciitis. And also if a patient's saying to me, you know, I've suddenly just increased my activity levels because I'm training for this, that or the other, or I'm on a health kick, you know, all of these come together to create a clinical picture for me to go, okay, I think this is plantar fasciitis. So looking at the management side of things, how do we deal with this? How do we help you? How can you help yourself if you have plantar fasciitis? So initially, the first thing I get people to do is rest from anything that's really aggravating it. I don't want you fully resting. Like, I'm not telling you to go home, put your feet up, not do anything for the next 6 weeks. I'm just saying if there's a particular activity that you've been doing, i.e. if you're coming into me and going, well, I've got, you know, you've got all the plantar fasciitis symptoms, but you've still been running 10 miles a day and it really hurts you, but you've still been doing it, and it's kind of worse after each time, I'm probably going to be telling you not to run 10 miles a day. Instead, I'm going to be saying, let's try swimming, let's try biking, let's do something that's a bit more offbeat just in the meantime to get it to settle down, because if we're not going to get it to settle down, we can't then get the progress that we need with it later on, because we've just got this angry fascia that's just not chilling out. So initially it is rest. Soft tissue to the plantar fascia and to the calf muscles and the Achilles as well, so that is massage pretty much. And we can do some mobilizations in the area as well, particularly if you've got that stiffness, that ankle dorsiflexion stiffness as well, then we will also be looking at ways that we can improve that too. And that could be through some self-mobilizations that we can give you with the band. There is actually, if you have a look on our Instagram, if you're interested in seeing the kind of mobilizations you can use for that, just put a comment on here and I will tag you. I will send you the Instagram link. Now we've got some videos that we've done for that. But that's really good at kind of improving your ankle range of motion that could then help reduce the pain. Yeah, as always, we always provide exercise, prescribe and provide exercises for you for pretty much any condition that you're coming in. So like I said, initially we're stopping the aggravating stuff, but we're switching it for something else that you can do. And then mobility wise, I'm looking at how can we get your calf muscles more mobile, you know, stretch them out a little bit. I'm also looking at your foot, so as soon as you come in, I'm going to be assessing your foot as well. What muscles in your foot are strong? Are the intrinsic muscles, which are all like the tiny little muscles that sit in between the smaller bones in your feet. You know, what are they doing? How much are they working? You know, I'm looking at all of that, and if I can see that actually, okay, I think your big toe's not as strong as it could be, let's try some of these exercises, let's do this. Because I need to problem solve around it, because like I said, you've not got this injury for no reason, there's something there that's happening. So I will be giving targeted exercises based on any of the weaknesses that I have seen. But generally ones that we use for plantar fasciitis, like rolling up a towel, and then you've got your, imagine this is a towel here, I've got the toes on the towel and I'm doing calf raises. That's a common one that we'll use. We might suggest a ball to roll your foot on as well to help with a little bit of pain, or sometimes you can put some water in the freezer and then you can roll your foot out over it. It just helps for a little bit of pain relief. Like stretching of your calves as well. And then often we'll do exercises further up the chain too. So what I mean by that is, yeah, you've got a foot issue, but actually if I think that some of the muscles around your hip are really weak and that's causing your leg to come in slightly, that's causing your knee to be strained, which is causing your foot to be strained, I'm going to address the hip, because actually, has that been the reason that we've got this foot pain? Quite possibly. It might not be the only reason, but it's probably going to be contributing. So often I'm giving people extra exercises for other parts of their body that you might feel like are unrelated, but you know, our whole body is kind of linked. We are a chain. So I will often give other exercises that I feel like are important to do. Shoe inserts as well, not for everyone, but you can get plantar fasciitis specific inserts. You can also get inserts that are just for sort of for helping with your arch as well. So sometimes if I can see that someone's arch is quite flat, I might recommend those insoles. Other people, I just recommend the plantar fascia ones. Some people get on with them quite well, some people don't. But what I would typically say with them is, if you're thinking about getting the plantar fasciitis insoles, is initially only put them in your shoes for a short period of time, because what people do is like, oh, I've got these new insoles, great. And then they go and they've got a job where they're standing up all day, for example. Maybe they're someone that's in tube stations or on the underground, or there might be a chef or something like that, or they're working a shop, you know, anything. And they're standing up all day and they've got these new insoles in, and then they've got pain. No, they really, really hurt me. Well, you've just done like quite a big change to how your feet kind of sit all day, how you walk, how you move around, and your body is just responding to that. So I'd always say for the insoles, put them in for a short period of time, a couple of hours, if that, probably even less than that, to be honest. And if that feels good, or you don't really react to it the next day, you can put them in for a bit more, and just see. Because that's the biggest mistake people make with those insoles, I say, is kind of too much too soon. So they're the main sort of ways that we manage it. So we've got, you know, what is the function of the plantar fascia? Basically helps biomechanically with the foot, helps with the arch of the foot. Plantar fasciitis is basically an overload injury, and you've got collagen degeneration there. So from doing too much too soon, but, you know, having excessive weight, having calf tightness, changing running shoes, footwear, anything like that can impact it. We use lots of different things to diagnose it, but typically morning pain in the heels is quite common, tightness in the calves is quite common. And then our management is a mixture of exercise and hands-on stuff. So that kind of sums up the whole of today for you. Has anyone got any questions about your heel pain, plantar fasciitis, anything like that? Please pop them in the group now, and then I can answer, comment on here, so I can answer them for everyone, because if you're thinking it, someone else probably is. If you have been noticing heel pain, or if this kind of resonates with you, everything I said today, and you think, yeah, that is it, you know, please pop me a message, put a message on a comment on here, and I can have a chat with you and just see if it's something that, you know, we feel like we can help you with. Or if this doesn't resonate with you, you think, I have got heel pain, but this isn't it, you know, it is probably something else that is in the area that we'll also be able to help you with. So just drop me a message. But I'll just leave you for a few seconds to write any questions that you may have on the chat. Don't think we've got any questions, but if anyone thinks of any, please feel free to drop me a message anytime, or put a comment on this video, and I will get back to you. But thank you so much for joining. I hope you have a lovely Monday evening. Bye.